Ladies and gentlemen, you are tuned in to the #1 podcast for the Sickle Cell Community. You're listening to On the Air Sickled, where we air the good, the bad, the ugly in the name of awareness and advocacy. I'm the executive director and host for On the Air Sickled, and we are live, ladies and gentlemen. And this is a special broadcast here at On the Air Sickled. This particular episode is an exclusive. It's called Dr. Simone Says. Well, it's called Simone Says, but it is featuring the one and only Dr. Simone. I'm talking about warrior. I'm talking about wife. I'm talking about physician, author, and co-founder of Sickle Cell Medical Advocacy, Dr. Simone Uwan. Before we bring her on, I do want to go ahead and share our weather forecast for you. It is a high today of 35 degrees with a low of 20 degrees. We got hit last night with a little snowstorm, the continuation of the snowstorm from a couple of days ago. Tomorrow's forecast is a high of 41 with a low of 22 degrees. Make sure you stay warm. Now, let's jump right into this. Today, we're talking about an extremely relevant and impactful subject. The first being that of Oxbryta, and the second being Adakveo. I'm talking about Oxbryta, which was a medication that was given to the sickle cell community to be able to help and to be able to support and maintain our well-being. Suddenly pulled from off the shelves, putting the medical providers and the sickle cell community into a spiral and causing us to have to find some other way to maintain our health. Then we're going to be talking about Adakveo. Adakveo is an infusion-based treatment. It was released by the FDA in 2019 to support and reduce the frequency of vaso-occlusive crisis, which, as you know, if you have sickle cell disease, that is exactly what happens when we go into that pain. Our vessels are constricted, and we wind up going into the emergency room. And Adakveo is a form of treatment that has been approved for those that are 16 years and older. So without further ado, we want to hear straight from the words of the physician, from our one and only Dr. Simone Uwan. Ladies and gentlemen, Dr. Simone, you are live on the air.
Good
Hello,
to be
how are
here.
you? How are you? Thank you for joining us. This is your show today.
All right.
Excited because, Dr. Simone Says has now partnered with On the Air Sickled for exclusive episodes monthly. And so today we want to talk about this topic of the impact of Oxbryta and Adakveo. It is your show, Dr. Simone. Tell us what you think about it. What happened with Oxbryta? Let's start there.
Okay. Well, let's go back to Oxbryta coming out on the market. Let's go back to 2019. In 2019, what did we have for sickle cell and any kind of help for sickle cell, right? We had gone, pretty much from 1909 all the way to 1919. I mean, can you guys believe it? This is over a century without with only one medication that was specifically designed for sickle cell. So from 1909, to probably somewhere around the 2000s or so, we had nothing. We had nothing for sickle cell at all. And so people were just literally feeling the pains and the pangs of sickle cell disease and dying with sickle cell disease. All of a sudden, there was a discovery of a medication called hydroxyurea, where people, it was actually made for other leukemias, and people discovered erroneously that it was causing the body to create more hemoglobin F, or fetal hemoglobin. And that was the first time the idea of increasing fetal hemoglobin became became a topic, but it it caused fetal hemoglobin to exist in elevated levels, and fetal hemoglobin does not have any genetic malady. It does not have the genetic defect that causes the body to have sickle cell disease. So the baby is first born with fetal hemoglobin, and at some point around about 6 months or so, we shift from fetal hemoglobin to adult hemoglobin, and at that point, when it shifts to adult hemoglobin, it's the adult hemoglobin that carries the defect for sickle cell disease. And that's the time where you can start to see, the symptoms of pain and so on for sickle cell disease, right? So now we find something that is causing fetal hemoglobin to persist in the body, and the fetal hemoglobin does not have the genetic defect. And because of that, suddenly everybody's excited to put hydroxyurea into the sickle cell space to see if this persistence of fetal hemoglobin that they're seeing when they treat their leukemia patients, if this would actually help the sickle cell community. And it did. And so suddenly we have a talk of, wow, the persistence, if you can create anything that causes the persistence of fetal hemoglobin, you can actually create um, some sort of treatment for sickle cell disease. So that was the first time we ever got any sort of help. It was kind of by accident, but it was helpful, and it still is helpful to some people today. But it wasn't specifically for sickle cell disease. So it wasn't until 2017, over a century, that something was made called Endari by a company called Emmaus. And that was the first time where you saw people getting any benefit. And again, Endari was made essentially to replace something that the body naturally makes. It is a naturally occurring element, and hoping that by replacing that element, the 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 person would feel better and not have a sickle cell crisis. So up to 2019, we only had one medication that was made specifically for sickle cell disease. And I'll never forget the week of November in 2019 when I myself was in the hospital as a patient, and I heard that there were two medications that were coming out like a week apart of each other, and that was Oxbryta and Adakveo. They came out like a week apart of in the month of November in 2020, November of 2020. November of 2019, I'm sorry, November of 2019. And so we were so overjoyed, right? Like suddenly we went from one to three options that people could use. And that was a happy time, because hydroxyurea was great, but it wasn't for everyone. It was actually only tested in people with genotype SS, and you need to know that essentially we have many genotypes for sickle cell disease. And so if you only target one, which is the main one, the most common one, that's great. But you leave out a whole army of people that are still suffering because they don't have SS, they have other genotypes for sickle cell disease. Um, so that was an issue. then Endari came along and it helped some more people, and that was great. And it's kind of like anything else. It's like blood pressure. The same one medication that you give one person will not help another person. So they have a myriad of different blood pressure medications because, people have different genetic makeups, and you'll try one and it won't work. You can try three or four and it doesn't work, and then the fifth one works, right? And so the same is true with a disease. You have to have multiple different treatments because people's genetic makeup is different, and one size does not fit all. So you need to have things like other medications coming down the pipeline in order to help people. So we were overjoyed because we now had Oxbryta and we now had Adakveo. Now let's talk a little bit about Oxbryta. So we landed with Oxbryta, and I heard many people being helped. Okay. Oxbryta came in a tricky way that, looking back, we realized that we should have been able to alert the community that it wasn't a done deal. So essentially, Oxbryta was in clinical trials, and it was looking so well. The results were looking so good that, because they knew that, hey, this is a people that only had one medication, for them, and it was only helping some people. Let's try to get this out to help, more people. And so they did. They put it out. Some would say prematurely, but if when you have orphan drug status, and that's what it's called, it's orphan drug status, they were able to essentially appeal that, hey, this is a community that's stressed, they don't have many options, and we're seeing great results in the clinical trials. Let's release it, and then, we'll still continue to study it, but let's at least release it so that they can get some relief, right? And so when it was released, people actually thought it was a done deal. People actually did not a lot of us did not fully process that, hey, you know we're dealing with a different status here. This orphan drug status thing is different, and we need to still be paying attention to the data that's coming out, because the clinical trials are still continuing, right? And so all of a sudden, here we are, we're in 2024. This was in 2019 that this drug was released. We have had people in the US, in Africa, in the Caribbean, many people on this medication, and many people doing well, right? So all of a sudden we start to hear, well, I start to hear, of a few things happening, but I wasn't really sure that it was related to Oxbryta per se. Okay, the first was a good friend of mine. um he was on Oxbryta for a year, and he was doing so well. In fact, they were going to make a commercial with him. And then he ends up suddenly, right after celebrating his 60th birthday, suddenly having a heart attack and dying, right? And I was besides myself. I remember it. I was actually teaching at Sickle Cell Medical Advocacy. I had to take the week off which I've never done in any subsequent times. I had to take the week off from teaching and record the video later and give it to the students. But I was devastated. Even going to his funeral, I was devastated at the funeral. I couldn't handle it. I We had to leave. So it was definitely one of it was a shocker. And looking back, you know, I I remember wondering, I hope that it wasn't, his new medication. He was only on it for a year, and it was new, and I knew that medications, can can reveal things after being on them for a year or more, right? So it did cross my mind, but I wasn't sure. And honestly, it was one person, so I wasn't sure if there were other things going on. Fast forward, and we are in the month of sickle cell awareness, right?
September.
Yes. And suddenly, I mean, as suddenly as you can imagine, one day I look up and someone is telling me, you need to check out this thing that just happened. I sent you a link. Open it right now. And I opened it. It was like about maybe 6 o'clock that evening. I open it and it says Oxbryta withdrawn, because voluntarily withdrawn. And I have to add that it was voluntarily withdrawn by the company because of concerns that they were seeing in some sites, of debts, and they weren't sure that the debts were related to Oxbryta in some cases because of coexisting problems. And see, that's the thing in our community, right? Because we are a very sick people, and there are a lot of things that can also get us sick. We have a low immune system, so we can have infections and so on. And so when something happens, it can be difficult to determine what is happening. Like, is this a sickle cell crisis? Are you having is there an infection? What's going on? I hope you guys didn't just hear my doorbell. I'm so sorry. Sorry. um but is it an infection? We don't- you have It's hard to tell what is going on, right? Man. And that puts us in quite in quite a situation, y'all, because then when something happens bad, the company can actually do one of two things. They can either accept responsibility, or they can say, well, hey, this was a really sick person anyway, and they had other, confounding problems anyway, so hey, you
And that's
know
what happens a lot of times is most companies just blame it on the illness that the individual already had.
yeah, yeah, exactly. They usually just blame it on the illness, and and you never hear about what's really happening as a side effect of the medication. And so it was kind of a class act and a stand-up thing for the company to do, to say, okay, we're hearing about these things. Let's not wait for more deaths to happen. Let's not wait for the FDA to come and knock on our door out of concern for an overwhelming amount of deaths. Let's try to pull it ourselves. And so essentially that's what they did. And what how it happened was my beef, right, with them, because I think it seems like they just freaked out and just stopped it, like, just cold turkey. You can't get it in pharmacy. You won't get it ever again. You know, they hadn't even communicated anything to anyone, like the doctors. Forget about the patients. None of us in the sickle cell community, and we have connections to many of these pharmaceutical industries because they're in our community. We have point people that we talk to say, hey, what's going on, which is what I did. I was like, I picked up the phone and I was like, what the hell. I was like, I couldn't believe, and this was me, I couldn't believe I said that, but I was like, I asked him, I'm like, what is going on? Like, how come we didn't hear about this? How come we didn't have time to tell our own people about this?
Yeah.
This makes us look bad because we're supposed to be in the know, and we're not in the know. And the patients are learning before us.
Yeah, I mean, I would say, for me, I learned through social media. I learned, the news broadcasts. It's just suddenly, Oxbryta take. I was getting phone calls from my doctors at the hospital saying, "Hey, we need to taper you off." It was a whole. I mean, I said that in our introduction, but it literally was a spiral of events that happened.
Yes, yes, yes,
And
yes.
my question to you, Dr. Simone, is I was looking at I was on one of the Facebook group pages for sickle cell, and somebody had posted saying, I don't know what to do. Oxbryta was working for me. I'm one of them. Oxbryta I thought was working for me. Why do people think that the medication was working? Was there something
So yes, there.
that's a little
I
off?
think I think there is. So again, it has to do with how the hemoglobin works, right? So for Oxbryta, the whole way that it was supposed to work, it was is that it was supposed to make the oxygen bind to the hemoglobin more tightly in and when it delivers it to the body. So hemoglobin is the molecule that takes oxygen from your lungs and travels through with the blood, in the red blood cell, and delivers it to the tissues, right? Okay, so with Oxbryta, what it was supposed to do is it was supposed to affect how that hemoglobin functions, because with sickle cell, if that hemoglobin ever got deoxygenated, in other words, it lost all the oxygen, it delivered all the oxygen, and it stayed in a deoxygenated way. If there was ever stress to the system, in its deoxygenated state, it could sickle, right? However, if it was in a oxygenated state, in other words, it, the hemoglobin carries four molecules of oxygen, and right, and so if it was not dropping off all four, to the tissues, and it's like said dropped off two or three and kept at least one, then it could stay in an oxygenated state, and that would mean that it wouldn't sickle. The hemoglobin wouldn't sickle because it would have at least one oxygen molecule, right? And so the problem is, though, is that, you know, in order for you to have the oxygen stay on the hemoglobin, you have to bind it tightly. And so there was a problem with it getting to the tissues and not unloading some of the oxygen. But when you put that thing on your finger and checked for the oxygen in your blood, it looked like you had a lot of like, you were, if you checked, I'm sorry, if you checked the blood and you checked for oxygen, for how oxygenated it is, um it would appear as though it's well oxygenated, right? And that's true, but it's not dropping off the oxygen to the tissues for the tissues to use. It's looking well oxygenated because those hemoglobin is carrying all of the oxygen molecules. But when it came to dropping some of those oxygen molecules off at the tissue, they weren't necessarily dropping it off to the tissue. So you looked well, but you weren't always really well. Your tissues weren't really getting as much of the oxygen as people thought. And so a lot of people, when they went, they would say, "Oh, it increased my hemoglobin," right? And I went from, a 7 to a 9 or something like that, right? And that's true. It did increase the hemoglobin, but is it actually helping you with more oxygen? That increased hemoglobin, is it causing more oxygen to be delivered to the tissues? And I guess the answer was not really. And so sometimes it did drop, some molecules dropped oxygen off, and sometimes they didn't. So for the people who were feeling really well, they probably had, it was enough, the drop off was enough. They just needed a little boost, and the drop off was enough to help them. And then for others, it seemed like it wasn't dropping off enough, and so their hemoglobin would seem more elevated, and it would seem like, okay, you have more hemoglobin, that means you're good to go. But they weren't getting the oxygen from the hemoglobin to be delivered to their tissues. And so that was the problem.
So I want to kind of shift into Adakveo because I was on Oxbryta when Oxbryta came out. My doctor had told me about it, and like I said, I thought that it was working for me. Um, Luckily, praise God, I did not. I'm not one of those that had severe complications from it. Um, and when they pulled it, I was a little bit into a panic because you had mentioned it, my hemoglobin is going from this number to this number. Like it was going up. We were seeing positive results. I mean, Dr. Simone, confession, I could literally take it 2 days from when I needed to be seen by my doctor, and the results would show that there was an increase in my hemoglobin. Oh darn, I forgot to take my Oxbryta. Let me make sure I take it, and then the results were great. So it was working for me in my opinion based on what was shown on paper. But then my doctor also recommended that I go to Adakveo. And I had a conversation a few months ago with a gentleman who said, Oxbryta really didn't work for me, but Adakveo did. And in my case, Oxbryta worked for me, but Adakveo did not. Can you talk a little bit about what Adakveo is, how that came about? And it's called something else. I'm not going to embarrass myself and try to pronounce
Yes, yes, yes. It's called crisanlizumab. It's a nice long name, crisanlizumab.
it.
So or crizanlizumab, some call it. But yes, crizanlizumab came out, like I said, a week apart from Oxbryta, and it was like, man, we got goodies, like right, before Thanksgiving. This is awesome. How did Adakveo work? Adakveo is different. So the way Adakveo works is that okay, let me talk about our bodies first, and then I can talk about um, uh, uh, Adakveo. When you uh, as part of your body, the way your cells are in the body, it's almost like your red blood cells, your platelets, and some parts even of the lining of the wall of your vessels in sickle cell disease. It seemed like they had Velcro. It was like it was like everything had Velcro on it on the surface, which meant that if they passed by each other, they would just automatically get stuck, right? So there was a high likelihood that if your red blood cell with Velcro passed by, and if it passed by on the Velcro side and it passed by the wall, it gets stuck to the wall. If it passed by on the non-Velcro side, it would pass by, right? But with crizanlizumab, what they did is they found something that essentially put like a little tape over that Velcro. And the the for people in the science industry, uh it's a p-selectin inhibitor. So p-selectins are part of the inflammatory cascade, and it can cause more inflammation and so on. A p-selectin inhibitor would inhibit that process, but this p-selectin inhibitor for sickle cell essentially was that tape across the Velcro. And so all of a sudden you had red blood cells, platelets, the walls of the endothelium and so on being able to slide by each other essentially, because now the Velcro is covered. So we don't have no problems. We could just slide by each other and keep it moving. And so because of that, there was less blockage, there was less clumping, there was less blockage. And so that's how that one worked. I was actually taking Adakveo myself, and there are some nuggets that people need to know in order to take Adakveo that even the company doesn't know. And I believe it's because some things can come out in clinical trials, but some things have to come out just in life, in actually using the medication. And that's why when they release a medication to market, they're still looking at how the medication is functioning, because there's some things that just come out when you start using it, like as part, just in part of your life, and you kind of start noticing some correlations. When I started using Adakveo, and I must say I didn't stop because of complications. I actually stopped because of something else. Um, I decided to pursue natural ways of helping my disease, but or helping the disease. It's no longer mine. um so but when I started using it, the first thing I noticed was it gave me an allergic reaction. I'm very sensitive to things, so it would make me scratch my skin raw. And I remember my doctor saying, "Oh my gosh, wow, we got to put you on some Benadryl." So they put me on oral Benadryl, worked for like maybe 2 or 3 months. The next thing you know, I'm scratching off my skin again. And they're like, "Oh, wow, we have to put you on IV Benadryl." Pause. There is a whole rumor in our community that, oh, you know, PO Benadryl and IV Benadryl work the same way. So, you could just take the PO Benadryl, and we think that you're just, trying to get high on Benadryl. On Benadryl. Like, seriously? So, so when patients will go into the hospital and ask, "Hey, I need IV Benadryl. PO Benadryl isn't working for me." They would say, "Oh, well, no, we can't give you IV Benadryl because it seems like some people are, getting high, or they like the high, you know, of the Benadryl, and so we can't give the Benadryl." The function of Benadryl is to help to stop the itching that happens when you get opiates in the hospital. So if you get PO Benadryl and it doesn't work, you should be getting IV Benadryl. That is my stance to this date. Okay. Um, Going back to Adakveo, so it was scratching me. I had to go from PO to IV. The second thing I learned, and that was just by happenstance. I was talking to another person with that was on Adakveo, and she said, "Yeah, she's like that Adakveo is something else. It's too strong. My doctor has to put me um on 500 cc's of IV fluids first, to kind of thin it out when it comes into my body, and then then I'm good." And I thought, really? Huh. So giving like 500 cc's of IV fluids, it helps the body to like tolerate it. Maybe it's too strong. Okay, well, I'll ask them to do that. I asked them to do that. There was a market difference. And I thought, okay, this is good. But the thing that kept happening is whenever I would get it, I would have an infusion of the Adakveo. I could sleep for like 3 or 4 days because I'm not feeling well. I'm feeling achy. I'm feeling like I might go into a crisis. I feel like I'm in a crisis. I feel like I might go to hospital. I mean, it was kind of like that after right afterwards for like 2, 3, 4 days. And then it stopped and I was fine. And then I was great. And then for the next 26 days or whatever, I was great. Right. And so I thought, well, hmm, this seems like a crisis kind of, but I would prefer a scheduled crisis versus a non-scheduled crisis any day, because if I'm going to know when I'm going to be sick and then I'm going to be great the rest of the month, I'm good, right? But I also started noticing some things with eating. If I ate a lot of sweet, it didn't seem like the Adakveo worked anymore. So if I had something like sweet, and there are times when I know I can only have so much sweet. If I have more than that, I will go into a crisis. Today I know why, right? Today I know that it actually, you know, glycosylates the hemoglobin, what puts more sugar on on the hemoglobin, and it gets more sticky, and therefore it blocks, causes more blockage, and you get more vaso-occlusive crisis, right? So today I know that, but I would eat sugar, and then this thing would just seem like it stopped working for the rest of the duration of the month until I got my next batch, and then it would be fine again. And as long as I didn't eat any sugar, I'd be fine again. So I found myself like eating, if I wanted to eat something, I'd wait to the end of the month, like right before I was, going to have another infusion, and then I would enjoy, a little bit of something, and then it would stop working. But I'd be like, all right, it's only 2 more days. Let's go. I'm getting my new batch. Like I worked the system. I was like, hey, if that's how I'm gonna have to eat it, that's how I'm gonna have to eat it. So
Yeah.
I saw like certain things, and I worked with it. The last thing I would say is that whole phase of being, 3 or 4 days where you're like, I'm in a crisis right afterwards. Like, I'm in a crisis. I'm not. I realized that it was actually stressing the adrenal system for a lot of people, and they didn't know it. And so when I started suspecting it, and see, I'm just experimenting on myself. So, I'm a patient, but I'm also a doctor, so I'm paying attention to what's happening, and I'm going, what does this feel like? Huh, it felt like the last time when I was in an adrenal crisis. Oh, wow. I wonder if we gave the adrenal some support, if it would help. And so I got, it's called, female hormonal support. There's a male hormonal support, and I got it, by Good Herbs, and I got it on Amazon. And I would start taking it the night before I went in, and then I take it the night of, and then one more, and I'd be done. This thing completely changed how I received Adakveo in that days after period.
Mm,
It just I would take a Adakveo and just keep it going. Like I would take it, and I remember times before that where I would take the Adakveo. I have to call in, and Aunt Mar knows what I mean. I have to call into my navigators, announce that I'm going for an infusion, and people knew not to call me, and somebody would cover me. I mean, it's a whole thing because I knew I would be out for a few days. When I started taking this thing is when I stopped announcing that I was going for Adakveo, because suddenly I wasn't having the crisis right after, because it wasn't crashing my adrenals, because my adrenals were supported. So there are some things that I tried to reach out to the pharmaceutical company to tell them, and they just did not respond. I don't know what else to say, but they just did not respond. And so I feel like Adakveo is failing, and it doesn't have to, because it's a good treatment, but people don't like what happens right after they get the treatment, that they feel like they're going into a crisis that could be averted, and if they have any allergic reaction to the treatment, that could be treated. I mean, there's so many things, that, or the fact that they might eat sweets and it will stop how the thing works. They don't know that, so they will probably think, well, I'm taking this thing and I'm not feeling any better during the month. Well, because it got inactivated and you don't even know that that's what caused it. So people were experiencing it. Some people were experiencing it in a good way, probably because they happened to not have sweet tooths, and they probably didn't eat as much sugar, and so they could enjoy, the month worth of Adakveo. Um, or they might go through that post infusion haze, and then they knew that they were going to get the rest of the month, and so they were okay with that. But then others, were experiencing it differently for all the reasons I just said, and they didn't know to do anything else. And so I feel sad about that, because I feel like if people knew these things, they could actually approach it differently, and it could work better for a lot more people.
yeah, I definitely was one of those that felt like I was headed into a crisis. They had to stop the infusion at one point and give me, Benadryl just to make sure that, I wasn't having an allergic reaction. I was like, no, I don't think this is an allergic reaction, but it is. It does feel like a crisis is about to start. I can feel it in my lower back. I can
Yes.
identify all these points. And eventually they said, well, you know what? Let's just stick to Oxbryta and see if that just works for you. And I was really dependent on the Oxbryta. So I mean, it just seems like you have to know your body. You have to know what works, what doesn't work. It's unfortunate the way that Oxbryta was pulled off the market. But again, frequent meetings with your doctor, and knowing what works, trial and error. Hopefully the error doesn't lead to death, but this is one of those medications that unfortunately did for several people, and it's really discouraging. But we are out of time here. I just want to give you a little bit of space, Dr. Simone, if you want to say one last thing to our audience for Dr. Simone Says.
Well, listen, I'm always having something to say, right? That's why Dr. Simone Says was coined. But I just want you guys to know about what's coming up with sickle cell medical advocacy. I'm always excited about that. If you are a patient or know a patient with sickle cell disease, please call us at or connect with us at www.sicklecellmedicaladvocacy.org. We can help you free of charge. We pair with you, give you a patient navigator. It's like a guide that helps you when you go to the hospital, if you go to the emergency room, or if you're in the hospital and you're not being able to communicate clearly what your needs are. They can help you because they are trained on the national guidelines and what should be happening for urgent management of sickle cell pain crisis. And if you get in touch with us, we can give you one of those advocates or patient or navigators, healthcare navigators, sickle cell healthcare navigators. That's what I want to say.
All right, ladies and gentlemen, there you have it. Our partner from SCMA, Dr. Simone Uwan, who has shared some insights into the chaos that occurred with Oxbryta and some of the trials that are happening with Adakveo. Know your body, know what the medication is supposed to do, identify the symptoms, and make sure you have those hard conversations with your doctor. Ladies and gentlemen, that's Dr. Simone. Dr. Simone, thank you for joining us. We're going to put you in the green room. Just stick with us. Hey, y'all. So you've been listening to On the Air Sickle with our latest segment called Dr. Simone Says. Again, as she had mentioned earlier, if you need a healthcare navigator, you're in the emergency room, or you need support, please don't hesitate to contact Sickle Cell Medical Advocacy. You can go straight to their website at www.sicklecellmedicaladvocacy.org. On their website, you'll be able to not only connect with a navigator, but they will get some information from you, so that way you are in their system. And then if you wanted to also become a navigator, you have that opportunity as well when those courses arrive. So again, www.sicklecellmedicaladvocacy.org. And a special thank you to our sponsor. Our sponsor is SCMA, Sickle Cell Medical Advocacy. So if you need anything, sickle cell warriors, I am encouraging you, connect with Dr. Simone, connect with her team, connect with Sickle Cell Medical Advocacy, get yourself a navigator, and don't fight this fight by yourself. I want to make sure that you all know that it is a cold winter here on the East Coast. Please make sure that you stay warm. Again, our weather conditions for tomorrow: 41 degrees, 22 of a low. Make sure you have your heated jackets, your hand warmers. The snow did hit us again last night, so if you need to shovel, make sure that you are wearing those long johns. Make sure you're layered up, and make sure that you have some water so that you can not expel so much of your energy. Here's the weather forecast for today: high of 35, low of 20. If you would like to be a guest on the Air Sickled, it is very easy to do so. Please go to www.ontheairsickled.com. You can share your story. There's a tab for you to connect with us. One of our team members will read your brief story, get in contact with you, and you could be the next guest live on the air. And also, we have an opportunity for you to support On the Air Sickled. We have a 3-layered vision. So please make sure that you check us out. Our 3-layer vision is on the screen. It is for On the Air Sickle's continued growth and development, to support sickle cell research, and to conduct a new program, which I like to call the Flip the Bill campaign. For a second, just sit back and imagine you're in the hospital. You have family to take care of. You have bills to pay. Wouldn't it be nice if we could support you, maybe give you some money so that you can put groceries on your table because you've been out of work for a week due to a pain crisis? It will be so cool to be able to do that. Or perhaps an emergency room visit. We'll send you a check, pay that bill, and you don't have to worry about that. And that's $200, whatever the case may be, that's back in your pocket for your family. The Flip the Bill campaign can work, but it can only work with your support. So if you want to donate to On the Air Sickled, it's very easy. We have PayPal. Please donate to @On the Air Sickled OD. Again, @On the Air Sickled OD, and you can give any gift of any amount to that, and your monetary gift will go to support one of those three categories of our 3-layered vision. Ladies and gentlemen, thank you for tuning in for Simone Says. If you want to make sure that you don't miss another episode of On the Air Sickled, please connect with us on YouTube. Hit that notification button. Share this video with someone that needs it. We have a job to do as warriors or as members of the Sickle Cell community to be able to get the information out there. Again, this is On the Air Sickled, where we air the good, the bad, the ugly in the name of awareness and advocacy. I'm your host, ladies and gentlemen, OD. Please stay strong and stay warm.
Misunderstood, hurt, depressed,
forgotten, hopeless, anxious.
agonizing daily discomfort.
These are the thoughts, feelings, and emotions of people living with a rare disease called sickle cell.
Warriors that need their voices heard when no one will listen. Warriors
That need support navigating the medical system.
Warriors that need leaders who can speak eloquently and with confidence. It's time to lift every voice.
It's time to lift every voice for the warrior.
I am a voice.
I am a voice.
Brought to you by the partners of On the Air Sickled and Sickle Cell Medical Advocacy.